Right now, I am speaking to all of us. I want you to know your metro mayors are in communication and we speak with one voice. I also thank the many private sector actors who made the tough decisions to cancel their events or adapt their services, in many cases before they were even asked. This collective action has undoubtedly saved lives and represents the best of the Oklahoma standard. I also want to thank Mayor Bynum of Tulsa for his partnership and the governor for extending his restrictions statewide this week. The virus knows no boundaries, and our entire Oklahoma ecosystem must take this seriously for each of us to stay safe. As all of this was happening in those early days 3 weeks ago, I remember the feeling I had waking up each morning. Perhaps you had it as well. The waking brain has an interesting capacity to live in an earlier time. For a moment, it would feel like just another day, and then suddenly the remembrance would wash over me. I would realize it wasn't another day, that everything was changing very rapidly, and I would feel sadness. As I've had time to look back on that time, I have realized I was grieving. I was grieving the death of normalcy, the expectations that this spring would be like any other. I was grieving the loss of graduations and festivals, family trips, and Thunder games. I was grieving the loss of small businesses, of economic dreams. On a very personal level, I knew I wouldn't see my kids play basketball and soccer anytime soon. I wouldn't see my dad for who knows how long. So many of the things about Oklahoma City and about my own life, things that I just took for granted, were being robbed by COVID-19. I have to assume you felt the same. Now, collectively, we're moving into a new phase of this journey. The changes to our daily lives aren't coming as rapidly now. We're settling into our new normal. We're moving past grief into acceptance and hopefully resolve. On the surface, we're discovering new ways to live. There was a time in my household this week when 3 of the 4 of us were each on a different video conference, and I was the only one who wasn't. We're taking walks and enjoying family movie nights. In the midst of the struggle to adapt, I have picked up on a rising narrative amongst the people of Oklahoma City. Perhaps life isn't entirely all bad when lived at a slower pace. Below this surface, below this effort to celebrate the best parts of this new normal, is an anxiety, and a reasonable one. Some of the anxiety stems from the continuing threat of COVID-19, and some of it relates to the economic effects of this virus. Let me begin by addressing where we are today in our efforts to stem the spread of COVID-19 in Oklahoma City. Today, we have 396 confirmed cases of COVID-19 in the 3 counties that comprise Oklahoma City, and 18 deaths. Assuming our mortality rate is actually similar to other cities, those 18 deaths are one indication that our case number is far greater than what we have so far discovered. When I last stood at this podium, the number of confirmed cases was 67, and I was delivering our city's condolences to the family of the first fatality. A deadly 10 days have followed, and on behalf of the people of Oklahoma City, I give my condolences to all of the families of the 18 victims in our area so far. Remarkably to me, sometimes people still ask why we have responded to COVID-19 with measures not seen since the Spanish flu of 1918. It is quite simple. This is, by even the most conservative estimates of mortality rate, the most threatening virus since that time. Doing nothing was never really an option, but if we had done nothing, many thousands of our residents would die in just the next 2 to 3 months. Even just 1% of the Oklahoma City metro is 14,000 people. And this is not even to account for the total collapse of our healthcare system that would also ensue. And none of this is theoretical. In our own country, we have cities that are being ravaged right now. In New York City, over 1,500 people have died. In Seattle, 175 have died. In Detroit, 101 have died. In New Orleans, 125 have died. If we avoid those fates, it will only be because we took action swiftly at the local level and we sustained that action. This week, in keeping with the President's new guidelines, the governor's actions, and the recommendations of my public health advisory group, I have extended Oklahoma City's state of emergency till April 30th. We don't know how long this will last, and I don't think you should assume that April 30th will be the end of it. In fact, you should know that other states have begun to extend their restrictions all the way into June. Regardless of what decisions we make, as we make them, we will continue to follow the advice of public health professionals. We will rely on science, and we will prioritize the preservation of life. As you can imagine, I get a lot of questions about the details of our current restrictions. In my mind, I wish my proclamation could just say, prioritize life and use common sense. But people like to have more detailed guidance, and that's fine. We try to provide it. But let me address one recurring theme that concerns me. Too often, people are asking me to make exceptions that clearly increase the risk of spread. In their minds, maybe it's just a little bit of risk, and it's just for them, and don't worry, everyone will interact just the way they should, and no one will violate principles of social distancing. Please understand that I derive no more pleasure from this situation than you do. But stop trying to find loopholes. What that tells me is that you do not value the lives of the people at your company, your business, your organization, or just the lives of those around you. If you're going to make an error, make it on the side of caution. And if you're going to be selfish for your own life or the lives of those you love. It is understandable why we have privacy protections for those who have died. But the only regrettable aspect of that is that the reality can sometimes seem abstract. The deaths are merely a number. But I assure you, every one of the 18 people who have died in the OKC Metro this past week had a family. They had people who loved them. They had plans, just like you. Those plans are gone forever, ended by a silent killer you cannot see. Local attorney Bob Nafee certainly had plans. He passed recently from COVID-19 at age 62. His grandsons called him Bobo. He loved to vacation in Durango, Colorado. He never missed a home OU football game. The median age for all those who have died statewide is 57. This virus takes people in the prime of their lives, just when they were planning a joyful retirement and looking forward to time with their grandkids and trips around the world. Please, when you're trying to find some new angle that in your mind is worth it, ask yourself, what event, party, get-together, activity is worth someone's life? Is it worth yours? Let me remind you the basics of sheltering in place. First of all, stay home. That's your default position. You can leave your home for essential employment. That list of essential businesses has been determined by the governor's office. You can leave for an essential errand, like getting groceries, takeout food, or medicine. If you do go shopping, and if it is at all possible, please go alone. As tempting as it is to make your shopping trip a family outing, you must always ask yourself, is this worth the life of someone I love? And remember, though we encourage you to consolidate your trips, there is no need to hoard food. They will always restock, and you will always have access to the grocery store. And when you are at the store, keep your distance. I commend the retail stores that have taken steps to distance customers in line and create barriers between clerks and customers. I strongly urge all essential retail operators to employ these best practices. And finally, you can go outside for physical exercise. But remember, you must still keep 6 feet of distance between you and anyone not from your household. Also remember that we have closed all playgrounds, outdoor exercise equipment, and sporting courts. The virus can live on those hard surfaces for a long time. Again, it is a question of common sense, and it is a question of life or death. Let me speak for a moment about the secondary economic effects of COVID-19. I've spoken in the past about the moral obligation we have to those who are suffering a disproportionate economic loss. Some professions and businesses, through no fault of their own, became threats to public health overnight. We owe them more than our thanks. This week, the Oklahoma City Council approved $5.5 million for a small business continuity program. This will provide direct financial support and guidance to small businesses in Oklahoma City. We were fortunate that the people of Oklahoma City approved economic development stimulus funds in 2007 and 2017 that we are reprioritizing for this purpose. And we are open-minded about adding to the program in the weeks ahead. Of course, we also expect federal support to arrive soon. I commend our congressional delegation for their work. I commend all those working at the state level to provide individual and business support as well. I also commend those working in the nonprofit sector, which also has a role to play. The United Way and the Oklahoma City Community Foundation have special funds and are deploying resources to help the individuals affected. Organizations like the Red Cross, the Regional Food Bank, the Oklahoma City Public Schools Foundation, Homeless Alliance, and so many others are out there responding to COVID-19. Please consider making a charitable donation to a nonprofit providing response. And don't forget the little things we can do each day. Keep eating delivery and takeout from local restaurants. And from what I hear, a lot of nail techs and hairstylists are getting some much welcomed Venmos and checks from regular customers. Keep those coming. Remember that the economic suffering is disproportionate and that the sacrifices of some are keeping many of us alive. Dr. Patrick McGough is going to come up in a moment and share some updates about testing and our preparations on the healthcare side. Let me first, however, express my profound gratitude to the healthcare workers on the front lines of COVID-19 response. As this virus peaks in the weeks ahead and so much of our focus turns to the healthcare response, we will have much more to say about these everyday heroes. But today, thank you, thank you, thank you. Right now, the PPE situation is stable, but we know as the virus peaks that we will be challenged. And I am asking as your mayor for all of us to consider what we can do to help. It is possible that you are in possession of PPE and other supplies that may be of more value right now in the hands of our public health professionals. I am urging you to consider a donation. The Oklahoma City County Health Department has set up an email address for this purpose. Email PPE donations at occhd.org to reach out and offer a donation. If you're not sure if what you have is useful, just send an email and ask. Again, that is PPE donations, all one word, PPE donations, plural, at occhd.org. Let me also acknowledge the other frontline workers who have stepped up in these extraordinary times. Some you might expect and some you might not. Of course, we're used to thanking our emergency responders, our fire, police, and IMSA workers. Thank you. In COVID-19, we have also found a new appreciation for the grocery worker, the checkout clerk, the restaurant worker, the utility worker, the sanitation workers, the members of the media. We have learned these past few weeks who we really need in order to keep civilization going. Thank you. Our COVID-19 response continues to move through different phases. First, it was triage. We rapidly changed our way of life to stop the spread. Now we're getting used to that new normal, and we must sustain those actions until the virus stops spreading. We are also transitioning to a focus on the healthcare response as we brace for the virus's peak. And we are working to address the economic losses happening right now, while also starting to think about how our economy emerges from this crisis in the months and years ahead. Today, as I conclude, if I could leave you with only one ask, it is to take this seriously. People are getting sick and people are dying. This is a situation without precedent in modern history. There is no question it is causing incredible inconvenience and disruption, but that pales in comparison to the alternative. Thousands of deaths that would yield the same disruption, but only after tremendous loss of life. Please, please, please consider your life and the lives of those you love in every decision you make. And maybe even find moments to enjoy the simplicity of your disrupted life. On this idea of finding the upside in all of this, Barry Trammell of the Oklahoman wrote a wonderful piece this week, and I'd like to share an excerpt from it with you. He writes, We've all talked about how slowly time has passed during these strange 2 weeks, but don't blame it all on time. We've slowed down. Our clocks, our priorities, our routines, our normal have all changed. We want to go back to those halcyon days of February. We want to be around coworkers and friends and families, want to wait for a table at our favorite restaurants, want all of the people who were working 2 weeks ago to be working again, want the theaters open and the concert lights shining and the umpires yelling, "Play ball." But there's something to be said for slowing down, something to be said for a recalibration of American life, something to be said for checking on each other, something to be said for sincere conversations with the grocery clerks who every day might check out customers who are infected with the virus and don't know it. Something to be said for walking through your neighborhood, then later sitting on your front porch and saying hello to others who are doing the same. All these walks through the neighborhood might make for a healthier lifestyle, but we needed a mental health overhaul as much as we needed a physical health makeover. When the virus is gone, and I hope it's soon, maybe we can keep the good stuff that came along with the bad. The walks and the board games, the Sunday drives, and the apple pies. Maybe when things speed up, we can remember that it's okay to slow down. With that, I'd like to bring to the podium Dr. Patrick McGough, Executive Director of the Oklahoma City County Health Department, to provide some other updates. Let me also add that the roles played by the Oklahoma City County Health Department and the Tulsa City County Health Department have been critical this past month. Their independent public health advice is a big reason why our cities acted quickly in this crisis. We owe them our gratitude. I'll turn it over now, Dr. McGough.
Thank you very much, Mayor Holt. And I think it goes without saying, we are truly blessed with one of the most incredible leaders of our lifetime right here in Oklahoma City in Mayor Holt. On March 25th, the Oklahoma City County Health Department began operating a site to provide COVID tests to high-risk groups in our county and eventually opening it up to anyone exhibiting symptoms of COVID-19. As of this morning, April 3rd, we have tested 1,000 individuals at the site, and data shows us that about 13% of the tests we've given since March 25th have come back positive. I want to thank so many people that have been involved in our local operations of this site, and the list goes on, and Mayor Holt so eloquently thanked many, many people. I want to give a shout out to coordinated efforts, of course, with Bruce Dart, the Director of the Health Department in Tulsa, and to Gary Cox, Commissioner of the State Health Department. To every leader, every mayor, every council member in our city and our county who has done something to elevate awareness and elevate the importance of social distancing, of staying at home during this entire process. This morning in Oklahoma County, we have 237 cases of COVID-19 and 10 deaths. Statewide, 988 cases and 38 deaths. I say this to emphasize that those cases and those numbers are reflective of an 11 a.m. report. The numbers go up all day long, sometimes minute to minute. And so sometimes we get focused on numbers, but we know that spread is here. So I want to kind of encourage everyone, instead of thinking about cases and deaths, while that's critically important, we have to think about what we can do to stop the transmission and to end the deaths. So at the end of this very well-prepared speech that the communications department has prepared for me, I'm going to take a risk and go off script a little bit and just break down to tell you about getting the story straight. I want to go back to, for the moment, the site that we've developed for testing. We established this site to bring testing to residents of Oklahoma County and to help alleviate emergency room surge at our local hospitals. While we are thankful we've had the ability to test some, we are far from being able to reach every citizen who wants a test. Many factors go into the capacity to increase testing for everyone, and those factors can become barriers to testing if all the right pieces of the puzzle are not available at any given time. Again, why focusing on numbers can sometimes be less important. For example, we've had the capacity since March 25th to test the 1,000 individuals I mentioned earlier because we had ample PPE for our nurses to wear each day, protecting themselves and the clients while they were interacting at the test site. We've also had enough swabs to perform the test on the 1,000 clients driving through the testing site. Additionally, our lab partner had all the components up until now to physically do the test. We sent the samples each day. This system, this puzzle, has worked for the past week and a half, which resulted in our ability to test the 1,000 individuals here in Oklahoma County. When our nursing and safety staff arrive at the testing site each morning, the very first question on their minds is whether we'll have enough to continue testing throughout that day. We're hopeful we'll continue having all the pieces and ultimately begin testing anyone who wants a test. However, we know that day by day, the situation is ever changing and frequently minute by minute. Today, we currently have enough PPE on hand to continue testing into next week. However, we're not certain we'll have the lab components to continue the testing next week. Unfortunately, our entire country is still experiencing discrepancies in the number of available tests on any given date. Until this is resolved, we cannot with certainty predict when tests will be widely available to anyone who may want one. Still, we continue to open our site here in Oklahoma City each day as long as we have the items needed to perform the test and we have the PPE that protects our staff and the public. I'd like to thank the many partners who are working with us each day to ensure our testing site logistics run smoothly so we can get individuals who need testing the most in and out in an efficient manner. We are working extremely well with our local partners, including the Oklahoma City Police Department, Oklahoma City Emergency Management, the State Fair Park Homeless Alliance, Variety Care, Regional Medical Response System, Oklahoma Hospital Association, OU Med, Health Alliance for the Uninsured, ACOG, and Oklahoma County. These partners are helping with the site, and there's probably some that I've forgotten, and I ask in advance for forgiveness if I did not mention your name. But there are volumes of other partners that are helping with many other aspects of the COVID-19 response. While testing capacity is an ever-changing target, it is also critical that during this time, we remember that many in our community don't have access to a primary doctor and they may be uninsured. OCC organized a joint venture along with Variety Care for the uninsured in our community. Our two agencies launched a hotline specifically for the uninsured and those without a primary care doctor to receive virtual guidance on questions they have about symptoms and whether they can receive a referral for testing at our medical referral site. The hotline number is 405-425-4489. It is staffed Monday through Friday, 8 a.m. to 4:30 p.m. We know that April will be a difficult month for all of us here in Oklahoma County. Models across the nation show Oklahoma can expect to see peak infections, cases, and deaths sometime later this month. Our team is working on various initiatives aimed at identifying alternate care sites that can be used once our hospitals begin to experience a surge in patients. We are part of Governor Stitt's COVID-19 Solutions Task Force, which is looking at facilities in Oklahoma City and Tulsa and the state to determine locations for these alternate care sites. While we're not there today, we do know it is coming. How we respond in the days and weeks ahead will be critical for how we come out of the other side of this peak and this surge. I urge everyone to remember the key things we all must continue doing to protect ourselves and the community and our loved ones. Stay home. If you have to go out for groceries or to work at an essential business, please maintain your distance from other people. Wash your hands repeatedly throughout the day, but especially after you've gone to the grocery store or public place. Please do not visit others' homes. If you begin developing COVID-19 symptoms, call your doctor or the OCCHD hotline if you don't have a doctor. I've said this before, and I want to reiterate today, we will get through this trying time together. We'll have many lessons learned, but until then, we must prepare now for the tough month ahead. Before we take questions, I want to speak briefly off script to these items about getting the story straight. So many people are focused, and I understand very clearly why, on the ability to test and the number of cases every single day. But I want you to know that testing as well as PPE changes minute to minute. Everyone in the nation is looking for the ability to broaden their testing. Everyone in the nation is looking for PPE. I want to assure you that across the state of Oklahoma, everyone is doing everything they can to find the ability to test more widely and to provide us with the PPE that we need. I cannot assure you that we have either of those for any extended period of time. I do know that many people in state and local government are working on both. As far as the cases and deaths, the worst tragedies of COVID-19, these will continue to climb, but are not truly representative because of our ability to test. So please know that while we're announcing a certain number of deaths or a certain number of cases, those will ever be climbing. It is up to us to make the difference, to minimize that case total, to minimize those deaths. There is no vaccine available, we all know that. So what needs to be done? We must stop the transmission. How? We've said it before, and we're going to keep saying it. Wash your hands frequently throughout the day. Keep physical distance of at least 6 feet from others. And aside from those you permanently reside with in your home, stay 6 feet away from everyone, everywhere. Do essentials only. Buy food. Buy needed medications. Do not go visit friends and family that do not live with you. Conduct business electronically. Some examples are through Zoom or phone conferences. Do not shop randomly. Have a list of the items that you need before you leave your home. Do not hoard items. Think of others. I want to point out to everyone, and this is just a thought that keeps resounding to me over the last few days. There is one common enemy that we must all be fighting against, and that is COVID-19. Approaches, messages may vary across the board, but in the end, we have to stop it. We have to end it, using the examples that I provided and that Mayor Holt so eloquently continues to provide to the public through various forms of social media. Take the most aggressive approach guidance that you are given. Shelter at home. Remember, it is not the elected officials, state, local governments, it's not the public health officials, it's not the medical communities that are the enemy. The enemy is COVID-19, and you are the answer. How you respond, the actions that you take, determine the severity of this war. I know of no one trying to withhold testing or treatment within the state of Oklahoma. I appreciate very much the governor, mayors, council persons, commissioners, and everyone involved for anything they are trying to do to limit the spread of COVID-19. I want to thank again all the nurses, all the doctors, all the public health professionals, and I want to thank you because I know that you are trying to make a difference. I feel that the majority of people are trying to stop the spread of transmission. We still have people that don't understand. We still have people that seem to be self-centered. If you see that going on, please feel free to educate them. Please be aggressive and end COVID-19. And with that, we will now take questions from the media.
Okay, members of the media, we will now take questions. When I call your organization's name, please press *6 before you speak. Do we have anyone on the line from K4?
Yes.
Okay, go ahead. We can hear you.
Okay. This is for the mayor. Are you thinking about putting in a curfew for Oklahoma City?
Yeah, I've seen that other cities have done curfews around the country, but it's not necessarily been adopted by many cities. I continue to listen to, the advice of public health professionals, but honestly, that particular regulation just hasn't really come up or seemed necessary or helpful to limiting spread. We're still open-minded to anything, but it just hasn't gotten any traction here in Oklahoma City. But I never judge any other mayors for what they feel is necessary and appropriate to their situations, for sure. But that is not a current ongoing conversation here.
KOCO.
Hey, thank you. Mr. Mayor, the executive director talked a little bit about this, but where do you think the actual level of cases is right now? What would be your message to people who see the number of cases and may not be taking it seriously? And then just help people understand what is it like being a mayor during a time like this and making these decisions for us? Thank you.
Sure. Well, on the first question, when I hear almost 400 cases, I think that's a lot, and I think that's staggering. And when I hear 18 deaths, I'm overwhelmed by that. If anyone else feels that those are numbers not to be concerned about, then we just have a different perspective on it. But I think, as I alluded to and as you reiterated, if the mortality rate of COVID-19 in Oklahoma City is anything like the mortality rate around the world, and it probably is, then we probably have a lot more cases to match up, with the number of deaths that we have so far. And obviously, we suffered as a community and as a state for many weeks with a nationwide testing shortage that we're only now kind of recovering from a little bit. And so we're playing catch up with identifying all of those cases. I think everybody should just assume that everybody has it, you should assume it's in every room you walk into outside of your house and take necessary precautions. And if you need to hear someone say that there's probably well over 1,000 cases in Oklahoma City and not just 300 or 400, then I'm saying that because I'm sure that is the case. And I'm sure that it's probably beyond that. Public health officials would know better than I. Your second question was asking about what it's like to be mayor. Obviously it's been a whirlwind of a 3-week time period. Obviously, you're put in a position, all mayors around the country and around the world have been put in a position seemingly of making these terrible choices, but realistically there is no choice at all. You're going to choose life over death. The unfortunate issue is that you've got a choice between life and a choice between economic loss, but as I've articulated here and in previous remarks, you're going to have the economic loss either way. If we had done nothing, thousands of people would have died and nobody was going to go to a restaurant in that scenario either. So it was going to happen one way or the other. The only thing you can do is try to get ahead of it and save those lives. And even though we accept the reality of economic loss in any scenario related to COVID-19, we don't accept the outcome that leads to. We want to help people, and that's why we're trying to do that at every level of government. But still, as a mayor, you still have to pull the trigger and make those decisions ultimately. So obviously, as I've talked about here and as other mayors have talked about, that's been an excruciating choice, and it's tough to take those actions. But you do know that you're saving lives, and that's ultimately the fundamental obligation of a public servant is to protect the lives of our residents. So I'm at peace with what we've had to do, but we certainly don't want to forget those, as I've said, that bear the disproportionate brunt of those economic losses. Other than that, it's obviously just been a hectic time, and you would think that with the cancellation of virtually every speech, appearance, or meeting that I've had, that I would have a lot of time on my hands, but of course that's not the case. I'm always on the phone handling some aspect of this or another. We all have different roles to play. Fortunately, nobody depends on me for a lot of the public health aspects. There's a whole infrastructure in place for that here at City County, at the State Department, and our healthcare sector, and our hospitals. And so I've just tried to play my role, but that alone certainly fills the day. And I must say, it's interesting how many people have taken it upon themselves to spontaneously, and I'm not inviting it necessarily, but have spontaneously sent me nice notes and texts and messages of encouragement, and those do help, and that certainly has been a nice aspect of this, because it is certainly a stressful and grueling experience, and I have to steel myself for the weeks ahead, because we know that this is potentially just getting started. Thank you for the question.
News 9.
Yes. My question is, we've seen so many people that continually say we need to take this seriously. What do you think it's going to take for a lot of the population who's not taking this seriously to take it seriously? Do you think the state needs to be under a statewide shelter in place? Do you think that would wake some people up?
Well, it's interesting. All the mayors, and I talk to mayors from around the country, all the time, and we're all in an exercise of trying to understand mass psychology. We're all trying to figure out what button do we have to push to get people to take it seriously. I mean, unquestionably, a lot of people have. It's just the diminishing minority every day that you're trying to focus on. And when I see news stories about people, ripping our caution tape off the playgrounds and allowing their children to play on something that could be covered in COVID-19, those are the moments where you think, I've obviously not reached everybody yet. And so we all are trying everything we can to spread that message. And I see what people are doing around the country, and I'm sure you'll see me try every single tool at my communications disposal in the next few weeks to try to get that message out. Of course, as I've referenced before, we've all seen the funny videos of Italian mayors, just literally walking around their cities and yelling at their constituents. It may come to that for me, but right now I'm just trying to communicate with as much clarity as possible how serious this is. You see that represented in my remarks. And to your point about, statewide messaging, I'll leave that to others, but certainly here in Oklahoma City, we ultimately felt that even though the governor's actions of last Tuesday were very substantial in a legal sense, it's as much as there's as much importance on how you communicate it and speaking with clarity. And that's why we felt the message of shelter in place was very important. But I do think people around the state should understand that the governor's actions this week are functional shelter in place. If you've shut down the non-essential businesses and the non-essential employers, you've really left people with nowhere else to be but their homes. But here in Oklahoma City, we just felt that message wasn't penetrating until we made it very clear, and we called it shelter in place, a phrase that people seem to have understood around the country to some extent. But again, as I've said repeatedly, even when you say shelter in place, and the reason you're even asking me the question, we've been in shelter in place for almost a week, and obviously not everybody takes that seriously. And so I have tried to continue to emphasize the need for people to be my partners in this. We don't have the ability to necessarily enforce this at the individual level, and everybody in the city has got to take this seriously, and that's why we make appearances just like this to try to stress the gravity of the situation.
Fox 25.
Yes, Mayor. Just to kind of piggyback off that, you mentioned right there people ripping down the caution tape at the playground, some people not taking this seriously. Do you think you're going to have to up enforcement of the shelter-in-place order, and has that been a conversation you guys have had?
Well, I mean, we're open-minded, and certainly our police are responding to calls, but you also have to understand there's 650,000 people in Oklahoma City, and at any given time there's just a few hundred police officers on the streets, and they still have to enforce all the other laws that we had in place long before COVID-19. So again, when it comes to some of the early things we did, like enforcement on businesses and such, that's a little easier for our police to enforce, and they're certainly there to do that and willing to do that. When it comes down to the individual level, As I said in my remarks last Saturday, if you're waiting for an armed soldier to be in your front yard, forcing you to stay in your home, that's never going to happen. We don't have the manpower for that. We have to rely upon your understanding and your willingness to be a partner in this, and to keep yourself alive, and to keep the people you love alive, and to support your neighbors. And so we'll keep pushing that message. Obviously, we're here. Absolutely, we're willing to enforce these orders in the interest of public health. But we also have to be realistic. People are messaging me all day with something they saw of a gathering of 5 people, or this and that. And I mean, we can't be in all places at all times. It's just not feasible. We need that buy-in from the public in every grocery line, at every playground, at every basketball court. We need at every potential home gathering of friends. We need people to be exercising self-enforcement and taking this seriously, and that's why you'll continue to hear me and public health officials carry that message forward.
OETA. Telemundo. The Journal Record. Non-doc.
You're mine.
We can hear you. Non-doc, do you have a question? Okay. Oklahoma Watch. The Oklahoman.
Yeah, can you hear me?
We can.
Hi, Bill.
Hi, Mayor. I'm going to press the point on enforcement a little bit. Do you think if you arrest somebody and they're on TV getting booked and they're on the front page of the paper getting booked, it might emphasize the message?
Well, we're going to enforce the laws fairly and as necessary. We're not looking to arrest someone, just to have a media event. So, we have found that I think in every case that when our police talk to people, they comply. I mean, we haven't, I don't know what situation we would have to create where we would actually be arresting someone. I don't think we've had anyone, be resistant to the guidance of our law enforcement when they've been approached. So that's what we'll continue to do. It's just that, as I emphasized earlier, we just can't be in every conversation, in every checkout line, in every playground in Oklahoma City at all times. So, it's not just about personal responsibility as well. I should have said this earlier. It's also about influencing your spheres of influence, and if you're in a situation where you see people doing things that are unsafe, remember, they're putting all of us in danger. And to the extent possible, don't make a citizen's arrest, but I mean, share your thoughts about the realities of this situation, and of course, you always have the option to call police, and you should feel welcome to do so. But we're not looking for an episode to try and create an example of anyone. We just want to continue to enforce the law fairly and keep everybody safe.
Hello, can you hear me?
Yes. Who is this?
This is Janice with the Journal Record.
Hi.
I didn't press my button properly earlier. Are you finding that, especially retail businesses, are you finding businesses that are confused as to whether they can legally be open or not?
Well, I hear a little bit of that. I want to reiterate, that is, so the governor he stepped out there and he did the closure of non-essential businesses. And so, he's really kind of controlled that waterfront, and it's really complicated to try and get in the middle of that conversation. So what we have generally done is referred people to the governor's office for guidance, and I have only sort of seen a reflection of that confusion. I would have to assume that now, 10 days since his initial action, that everybody has sort of figured out where they stand by now. But I know that was a source of some confusion in the early days, and understandably so, all that I would say is err on the side of caution when you're trying to seek guidance. Just, remember to use your own common sense, and that if the proclamation could be summed up in a few words, it would be, as I said earlier, use common sense and prioritize life. And if you do those things, you'll probably be okay, and you'll probably be in the spirit and the letter of the law. Again, when it gets down to it, however, that whole question of what's essential and non-essential has been a state-level decision.
Thank you.
Sure.
Okay, C Free Press.
Hi, Mayor.
Hi. Doesn't anybody want to ask Dr. McGough a question?
Well, I might do that. That's a good idea.
Hi, Brett.
Mayor, you first, though. I'm picking up some concern among pastors. I understand this is secondhand that the governor had a Zoom meeting with some pastors this morning, and he was reassuring them that no pastor is going to be arrested and so on and so forth. I'm just curious. What about religious meetings here in the city? There's been at least one high-profile arrest of a pastor over such a thing. So
in Oklahoma, not in Oklahoma City.
Not here, sir.
Okay.
No, not here. High-profile arrest of a pastor nationwide,
Okay.
and that has created some sensitivity among pastors, especially. I just can't imagine if you're not planning on having a meeting why you'd be nervous about it. But that being said, what do you have to say to religious groups that may be thinking about defying the order?
Well, I have heard of no one, so we have an order both at the state level and at the city level that no gathering can exceed 9 people, and it's not necessarily that we're encouraging people to have gatherings of 9 either. It's just that that's a helpful number. It's the guidelines at the national level, and it provides for some practicalities. I mean, as for example, there's probably just under 10 people in this room, and sometimes you have to have some of these activities at that level. But I have really appreciated our faith leaders in Oklahoma City who stepped up very early. That gathering limitation actually did not go into effect until about 10 days ago. So there were, I think, a couple Sundays, in this whole journey before we finally put that limit in. And most of the faith leaders, as I understood it at the time, had already acted to go to online-only services. And if there were any left who were still doing a service, they have all, to my knowledge, complied with the new orders, understanding why they're there. Lots of people, the reality is churchgoers are probably disproportionately older generations and are even more susceptible to the worst outcomes of COVID-19. And I think faith leaders understand that. They certainly don't want that on their conscience. So in Oklahoma City, I think we've had a pretty favorable experience with everybody being socially responsible early on and now being in compliance with existing orders. So I haven't heard of anybody who has felt otherwise in my city limits.
Thank you, Mayor. Dr. Mack, you sound, I don't know, you just sound much more concerned now than you did at the very beginning. Is it because you're seeing people just sort of trying to stay in a normal lifestyle in spite of all of this? Is that where your main concern is?
I think, sorry, I was told to use a different mic. So I think possibly what you are continuing to see week by week from me is that, yes, there's a little bit of concern for people that don't seem to have concern about the situation. To me, Mayor's speech this morning was very inspiring, very compassionate, but was also very much almost just a tearjerker for me when you hear about people dying, our loved ones dying in the community and in our city, and friends and family. And, you know, we've had some friends of our office here that have passed away in the past week. And I think it becomes very personal. And I guess what I am hoping is that it doesn't have to be such a personal level for people to begin to care. It definitely, you know, the numbers are not representative of the number of cases that we have, which was one of my earlier points I was trying to make. Whether it says we have 300, you know, we may have 1,000. It's the limited testing ability that we've had since the beginning of this across the nation, not just here in Oklahoma City, not just in the state of Oklahoma, but across the nation. So it's not truly, the numbers that we see are not reflective of anything other than just to know it's there and it's growing. And I don't think people are understanding, as the mayor also mentioned earlier, which is a great point, is we all should behave like we're transmitting it. We should also act like everyone has the potential to transmit it to us. And then we would all be safer. And as I mentioned earlier, the only thing that we can do is stop transmission. And the only way that we can do that is really up to the citizens. Because since we don't have vaccine, and we don't have widespread testing capability, even though I consistently hear that that's going to happen, and I believe that people are telling the truth. I think it will become very common to be tested. So I don't think there's any hidden agendas or anything behind dark secrets. I truly believe that we will begin to test widely. But I think that the important piece to realize, even the surge that's coming on the hospitals, we can still change that if we stop transmission. And I think that's why every day it seems more and more serious to me, because I know that surge is coming. And if you want to make the difference for someone that you love, for yourself, for the community, just for people in general, because you're a caring person, you need to heed the warnings, take the advice, and please do what we're asking. And that's still stop the transmission, stop being physically close to people less than 6 feet, wash your hands all the time, don't do anything that's not essential. We just are going to continue to repeat those. So I think that's it. It's just ongoing and continuing to see even the few that remain to seem to defy what we're trying to get them to do is very sad to me.
Thank you both.
Do we have anyone from radio on the line that would like to ask a question? Have I missed any print or TV outlets that have a question?
Can you hear me? This is Veronica Passfield from Territory Media.
Yeah, we can hear you.
Hi, Mayor. Okay, I have a couple of kind of more specific questions. One thing that I think that it's important to also keep in mind is that media has to sort of plan for our surge and coverage. So I say that as a precursor to my question so that you understand I'm not going to ask this question because I'm trying to, you know, enhance any kind of negativity or panic or sensationalism. Oklahoma Watch last week reported that there is an estimated peak date of April 23rd and an estimated mortality of 52 deaths per day. The source they linked us to was the Institute for Health Metrics and Evaluation at the University of Washington. Two more data points I just would like your input on. This individual source did not estimate that we would have a ventilator shortage, but that we would have a significant, maybe percent or better, ICU bed shortage. What do you make of that reporting at this time, and what do you make of that timeline? Is that something that we all should be planning around?
Probably defer to Dr. McGough on that.
So certainly, I want to defer to the mayor too in a moment if there's things that he may be aware of that I'm not. All of this changes, as I keep saying, minute by minute, both our response and the facts and figures So I know that the article that you're speaking about, I think it was from IHI, and I've seen that, and I know that's even being viewed at every level within our state, from the governor's team. His task force is looking at that article. The local hospitals in Oklahoma City and County are looking at that. Everyone is taking a look at that. At best, those are projections or extrapolations from what we've seen in other states and cities across the nation and perhaps even the world. And I think what we're trying to do is just gauge when the surge may begin, when we may see a decline. But there's so much still, I just want to emphasize, that depends on every single person as an individual about when that surge hits and then when that surge begins to decline. And then speaking to the ventilators and the hospital beds, I know that is aggressively being worked on at our state level, both governors, the governor, the mayors, I mean, that's across the board. State Health Department, the task force is working on that. Our local CEOs of our hospitals are very involved in that process. State, city, county health department, Tulsa City County is involved in that as well. We're looking at sites, as I mentioned earlier, and there's a number of different options. Here locally, what's happening is we're working with OU Medicine also on trying to identify some pod sites for med-surg, a surge in med-surg patients that may need treatment or follow-up. So a lot is in the works, and so I feel comfortable that we're ahead of that, that it is being reviewed, it is being considered, and that people are using science to try to get at it and address it. So that's basically all that I really can say. Mm-hmm.
Yeah. I have a quick follow-up on that. I mean, I definitely hear you guys both saying that everybody is just turning themselves inside out to solve this, myriad problems. It's safe to, would we be correct in reporting that that you are anticipating a shortage of beds and ventilators and PPEs once we get to the surge? I mean, when I look at New York,
yes,
I see, Governor Cuomo can't get ventilators. He expects, according to his interview on MSNBC last night, he was expecting to be out of ventilators in New York in 6 days, and they haven't even peaked yet. So, are we accurate to report that that you are anticipating a shortage like other cities in the United States, and perhaps that message, while not trying to sensationalize, would be helpful in motivating our citizens from the media, kind of getting that message out too.
Correct. And so I don't want to misstate to any of these questions that you're asking, which are all very good questions, exceptional questions. I think, again, I know all those pieces are being worked on. I cannot say with any certainty that we already have enough beds, enough ventilators. I know that's being looked at and worked on. I think that there's a lot going into it. I think it's very likely that we will be prepared, and I think the difference, some of the difference is the proximity, close proximity that people in New York City and other large cities have going on that we're not experiencing in Oklahoma City just because we're not as crowded. But it's very difficult to speak to that. I really would defer to the task force and folks that are driving that, and I think that the governor and Secretary Luffridge addressed that in their press conference to probably a better level than I could actually do that. I still, want our message to be about let's flatten the curve, let's make a difference before we even get there. But even after that surge hits, it's going to be important that we continue the actions and that we don't extend the high point of that curve. So I don't know if that answers your question, but preparation is definitely in place, and I feel confident that people are doing everything they can. There is a shortage nationwide of hospital beds. Obviously, you see that on the news, and of ventilators. That's not a secret. I think we're doing our best to make sure that we make the best utilization of the resources that are there. It's the same thing for PPE, shortage across the nation, and everyone's doing everything they can.